elderly people are predominantly white, and that we should instead give it to people that are essential workers first, because essential workers are more often people of color, and that this will balance things out. Like, literally say, if more white people die, it'll be better because we'll have more of a balance.
This came from the CDC's advisory committee responsible for deciding who should...
Wait.
The Joe Rogan experience.
There was another disturbing moment where they were talking about the rollout of the vaccine. And Jamie, who was that guy that was advocating for not rolling it out to elderly people because elderly people are predominantly white, and that we should instead give it to people that are essential workers first, because essential workers are more often people of color, and that this will balance things out. Like, literally say, if more white people die, it'll be better because we'll have more of a balance.
This came from the CDC's advisory committee responsible for deciding who should get the vaccine first or not.
Yes. Who was the guy that said it, though? There was and everybody blew a fucking gasket, because that is really a crazy thing to say.
The problem is, like, I don't remember the name of who said it, but all members of this advisory committee supported it, except for one guy who was like, this is not based on science. Because if you look at the statistics, over 80% of people dying in this country from COVID are people old, over the age of 65.
Yeah, if you want to save lives, you would...
Okay, who the fuck said it, dude? Can you explain? Wait, what? First and foremost, black people have a much higher likelihood of getting COVID and dying from COVID than fucking white people do. So regardless of whatever this fucking fake Andy stat is, the reality is not that, okay? So I don't know who the fuck would have said some dumb shit like that. It's got to be like one stupid fucking tweet that like the right saw and lost their minds over. Jamie's on the case. It's on. Please, Jamie, get it.
Give it to
and like
people.
50% of people being hospitalized over 65. So yes, if you want to save lives, if you want to make it so our ICUs aren't like at max capacity, then prioritize the vaccine based on age instead of occupation.
There is a concern, though, that essential workers are the ones who spread it more easily because they have to be in contact with people.
I'm glad you mentioned that.
So it's not that cut and dry. So these essential workers that are getting it, like, these folks have to be at work. So if they have to be at work, they're more...
Wait, to mitigate racial inequity, the CDC wants to vaccinate essential workers before the elderly. Vaccinating by age would save many more lives. First of all, the reason why they would want to fucking... the reason why they would want to vaccinate essential workers before the elderly is because the elderly don't fucking run around, dumbass. The vaccine... Reason.com, very reasonable as always. Older populations are whiter, Harold Schmidt, a professor of ethics and health policy at the University of Pennsylvania, told the New York Times. Society is structured in a way that enables them to live longer. Instead of giving additional health benefits to those who already had more of them, we can start to level the playing field a bit. Oh my God, dude. Oh, why would you say something like this, dude? Why would you say something like this? Why? You know people are gonna fucking completely take this shit insanely out of fucking context. It's so dumb. It's so fucking dumb, dude. It's not if there's a consensus that this is the right thing to do. The Times knows. This is like... Jesus Christ, dude. Here's the actual report and what was said. Allocation of initial COVID-19, science, implementation, ethics, COVID-19 disease burden. Okay. The reason why you would want to vaccinate essential workers first is because they are they are at a higher likelihood to spread it, not fucking old people, okay? That's why. They spread it. They spread it to old people who end up dying. This notion that, like, by the way, this notion that, like, white people... Here's why it's misconstrued, this take. Okay? It's dumb as fuck. This approach runs counter to frameworks proposed by the World Health Organization and many other countries who say that reducing deaths should be the unequivocal priority and that older and sicker people should thus go before the workers, a view shared by many in public health and medicine. Okay. If there was ever an argument to be made for why essential workers should get it, it revolves around who is more likely to fucking spread it, not who's more likely to get it and die. Also, the other problem is we don't even fucking know if the vaccine stops you from fucking spreading it. The vaccine, as we know, stops you from experiencing the worst consequences of COVID, okay? Or stops you from, in a lot of instances, getting COVID, okay? But the vaccine might not even stop you from fucking getting it and spreading it, okay? We also don't know how long the immunity that you are granted. We don't know. By that logic, shouldn't elderly get it first? Yes, I think elderly should get it first. But if they're discussing the ethics around who should get COVID first, I can understand why someone would have a position as to why essential workers should get it before the older people. I don't agree with it, but I can understand why someone would make that argument. You can still get COVID with the vaccine, and therefore you can still spread it. They're talking about the ethics of fucking who to give the vaccine to in an effort to limit the spread of COVID. Dave Chappelle has COVID and has been hanging out with Joe Rogan. Also, regardless, they will have a 10-minute fucking convo on white people should be euthanized or something, when that's not the fucking position that that most people hold, while literally black and brown people are dying at much higher rates than white people to COVID. So, like, the conversation is useless. It doesn't fucking matter.
More likely to contract it if they get the vaccine and they're protected from it, then it will spread less likely.
So there's two things there. First is who the CDC designates as an essential worker.
That is actually a problem, despite the fact that Tulsi Gabbard is the one launching this this counterpoint. It is literally a problem. Like, podcasters are fucking considered essential workers, dude, depending on where you are. So that's everyone. Everyone that can and has a job currently is an essential worker. What? Yes. I'm in the 1A group and absolutely shouldn't be. Dude, take it. Fuck it. Take it. I have heard, and this is anecdotal, but I have heard that people that bring their fucking parents to get vaccinated also end up getting vaccines because people are just not showing up and getting their vaccine shots. So they already have like a bunch that they're throwing out. So if you have the opportunity to get the vaccine, fucking take it, dude. Okay? Abso-fucking-lutely get it. Is that why you started a podcast? Yeah, so I could get the fucking vaccine? No. Throwing out vaccines, what the fuck? Guys, we talked about this months before the vaccine was actually fucking... Like, the months before the vaccine was finally ready for distribution. That the way that they distribute the vaccine is in cold storage that you open per day, and there is a finite amount that you have to use or else it goes bad. And in the end of that day, if you still haven't fucking used the vaccine, you just throw it out. Okay? So yes, Murat was telling me that in Oklahoma, They just do roll call, basically. Like, if they have any vaccines in the middle of the day remaining that people haven't shown up to take, they just say, like, come and fucking take it if you want it. They just do, like, a fucking news blast. And that's actually not a bad fucking use if we're being real. Like, that's not a fucking bad thing to do. I'm in Oklahoma, this is true. Yeah, that's not a bad thing to do at all. It's a good thing to do. Fuck yeah, go and get that vaccine, baby. Don't fuck around. At my workplace in AR, half of them refused. So yeah, older patients just showed up. Lol. Yeah, like a big chunk of first responders and shit in, I think it was like Ohio, were just like, no, we don't want to take it. Okay, I'll take it. Fuck you. Yeah, go do a TikTok dance while I take it. Okay? Much respect to the fucking... No disrespect to the nurses and shit, but like, if you don't want to take the vaccine, I will take it, motherfucker. You out of your mind, dude. I mean, also nurses and first responders and shit notoriously also don't take the affluenza or the flu vaccine either. The seasonal flu vaccines usually. But I get why they wouldn't do that. It's like 30%. Affluenza. Influenza, not affluenza. Sorry. Affluenza. Affluenza. Not trying to be attention Andy, but I work at a vaccine site in upstate New York, and we're supposed to give 1,000 doses a day, but hundreds of people cancel every day. Yeah, I don't know why the fuck, like... No, they kill other people by bringing back diseases, bro. There's no vaccine as far as we know from affluenza. My cousin is frontline, doesn't want to take the vaccine because she's afraid it might make her unable to have kids because no one knows the long-term side effects of the vaccine. Okay, bro. I'm a nurse in Texas. Our hospital is offering nursing staff a $500 bonus to take the vaccine because so many staff are refusing. I think people just don't want to wait in a line. I waited for 4 hours for mine, but like, fuck it. Right now, if you have both dosages of the vaccine, you don't have to quarantine if you're exposed within the first 3 months after the second dose. No, it's not microchips. People think that the vaccine process normally takes like 7 to 9 fucking years to fully figure out what the long-term side effects might look like, and they think that this is a fast-track vaccine, so they're afraid that it might have like additional side effects or long-term side effects that we might not know of, and that's why they don't want to take it. I don't give a fuck. I heard from a nurse friend that there are rumors spreading among young healthcare professionals that vaccine gives you HIV. What? Okay, that shit is psychotic. Okay, that's like literally psychotic. But you have to remember that like nurses and shit are also fucking susceptible to complete brain poison from the internet. So also the irony is, okay, so here's the other irony. Motherfuckers be like, we don't know the long-term health complications that may arise from taking this vaccine. Well, bitch, you don't know the long-term health complications of COVID either. People have reportedly like had cognitive decline and shit, brain fogginess. Okay? If I'm taking a risk, I'm taking a risk on science, baby. You know? Like, fuck that, dude. Oh, also, there is a known complication from COVID, and that's called fucking dying. You know what I mean? Like fucking dying because your lungs literally lack the capacity to pump oxygen. There's that too. That's pretty fucking bad. And if you get off easy, you might have long-term or forever lung damage with your lung capacity reduced up to 25% by just getting pneumonia. Pretty cool, dude. So, you know. I'll take my shot in the dark with a fucking vaccine, brother. The girls that grow up to be nurses are the same as the guys that grow up to be cops. Just an easy life to have power over people. Okay, dude, don't say that. I mean, I've met some fucking freak-ass nurses in my day, but that's not true. There's like, nurses are awesome. Even the crazy ones. Yeah, what the fuck? Don't shit on nurses. Like, nurses and cops are not the fucking same at all, dude. One literally does a observable good to society. They are crazy, though. Nurses are fucking crazy. All I'm saying is, you scoop out poop from an old person's ass as a part of your job every fucking day, you're going to be a little crazy, too. Sorry, every nurse I've met is a freak. In a good way, but also in a bad way, kind of. Shouts out to my nurses.
I'll get to that in a second, but all of this is built on the assumption that this vaccine will prevent the transmission of the virus, which is what we're hearing from some so-called health experts, which we're hearing from some in the media. It's not been scientifically proven. I've gone back and looked at the applications that and the data that was put forward to the FDA.
What about the U.S. history to use vaccines as a means of experimenting on the black community? I don't think that the overall vaccine is bad, but I don't know if I trust the vaccines being distributed to black communities to be safe. Dog. The type of fucking vaccines that they gave to black people are not the ones that they gave to the entirety of Congress, okay? Like, if these things were that bad and that dangerous, you think the entire fucking Congress would have been vaccinated before you? Are you crazy? You are right about, like, the horrible fucking, horrible tests being done on black people. Like, horrible medical experiments being done on black people. But you bet your fucking ass is not the type of vaccine, like, that would have ever been in the arms of congresspersons before the black people. They gave the real vaccines to Congress. Yeah, okay, bro. Shut the fuck up. Like...
to get approval from Pfizer and Moderna. And these vaccines have been scientifically established to...
It means black people might get a fake vaccine like the Tuskegee experiments? They were told it's a vaccine too? What? No. No. What? No. I know it happened. I know it happened. I am aware. I am aware. I am aware. I'm not going to watch AOC right now.
Largely prevent serious health complications and death from COVID once you're vaccinated. That has been scientifically established. Nowhere in their trials was it scientifically established that these vaccines would prevent the transmission of the virus. And so I see it almost every day, and it's incredibly dangerous where media outlets and some people who are healthcare professionals are propagating this. I mean, it's a lie. It's not true. But they're basically saying that, well, you know, people who have to go and work in these jobs that are essential workers, they need to get vaccinated so they don't spread it. Or even, you know, first responders. We had a local news station in Hawaii who shared a really emotional interview from a first responder, younger woman who had just gotten vaccinated. And she said, like, finally, I can go and visit my grandmother and not be worried that I am going to give her the virus because I'm taking care of people who have COVID every day. And what is so dangerous about that is she got the vaccine. If she has then gone and visited with her grandmother, she could still, and Dr. Fauci's talked about this and others, because this virus lives inside your nasal passage, you can be vaccinated and you can.
Okay. That was not a part of the fucking study. Okay? She's not wrong. That's what I just told you before I heard her rant on this as well, which is that you still might get fucking COVID, or you might actually give someone else COVID despite the fact that you are vaccinated. Okay? That's a fact. You could still do that. But that's precisely why we are trying to reach herd immunity. This is like the classic case of fucking the miscommunication around mask wearing. People were like, mask wearing doesn't prevent you from getting COVID. I was wearing a mask. It's like, dog, mask wearing is to potentially stop you from spreading it when you're fucking wearing a mask and you sneeze into it or you talk into it. Okay? It's to limit the opportunity, to limit the fucking viral load and limit you from giving COVID to other people when you don't know you have it. Not that it's like automatically a protective measure, a protective barrier that saves you from getting COVID no matter what the fuck you do. Okay? The same shit happens with this vaccine. The reason why we're trying to reach herd immunity and get a viable percentage of the population to get the vaccine is so that they don't get COVID, or even if they do get COVID in the off chance, the worst symptoms are eliminated. Okay? It's not a fucking magic bullet to stop you from spreading COVID further. If it wasn't proven to not stop the spread, we should assume it doesn't and not wait for the negative to be proven, chat. What is annoying here is making it seem as though this study was supposed to, or making it seem as though these are claims that, like, taking the vaccine will stop you from spreading COVID. No one has made this fucking claim. Okay? No one has made the claim that, like, oh, if you get vaccinated, you won't stop the spread of COVID. Like, no one has said that. So why are you guys having an argument as though, like, people are saying that? By the way, that's precisely why you should keep wearing a mask and keep doing social distancing until we reach a specific percentage of the population where we have herd immunity. It's not even about 100% eliminating COVID.
Still pass it on. And it could have a devastating effect on someone, for example, who is elderly, and who is vulnerable to this and who has not gotten the vaccine. So anyone who is saying that, well, we have to vaccinate these people or those people based on their occupation because we don't want the virus to spread, it has not been scientifically established that the vaccines prevent that. And this is why they're all, Fauci and these other guys, they're like, even if you're vaccinated, you have to still wear the mask. You still have to do social distancing.
Why would I vaccinate myself if I can still give the virus to someone? Because we 100% do not know that you can still get it. But if enough fucking people get the COVID vaccine, then you are literally starving the host that is supposed to be the carrier. Okay? It's the same concept as getting COVID or giving enough people COVID that it no longer is transmissible because you've already had it, so you have the antibodies. It's been established but not proven because holy fuck, it takes a long time to prove. Yeah. Also, so you won't fucking die. That's another thing.
Because of the potential for that. So I think that's such an important thing for people to know, especially as people are getting vaccinated, not to have this false sense of security that just because you've gotten the vaccine, now you can go visit grandma in the nursing home because you're not going to expose her potentially or put her at risk. But the second issue.
Reaching for straws, bro. We get it. You got the big tech script. Move on. Yeah, bro. Okay, good one, dude. Good bait.
Is if you really actually go on the CDC.
You really got me by doing fucking just fake fucking anti-vaxxer talk.
I've gone through all the CDC slides that the advisory committee put forward on who is a frontline essential worker and who's an essential worker. Healthcare professionals and first responders, obviously, yes. They are so overworked. They are overtaxed. They should be getting the vaccine right alongside our elderly over 65. But if you start getting past them and the people who are listed as frontline essential workers, according to the CDC, you're talking about anybody who works in manufacturing, anybody who works at a grocery store, anybody who works at what were some of the other ones? In agriculture, in any sector. Basically, you're talking about, half of all working people in frontline essential jobs. And then you go on to the essential workers, teachers and daycare workers, they're included in that as well. And then you go on to essential workers, people who work at banks, people who work in the media, basically almost everybody else who is in the workforce as essential workers. So this goes back to the thing that you originally said, is that part of their decision-making process was this kind of justice component. And making decisions based on who gets making decisions about who gets to the vaccine first, not based on who is most likely to die or get seriously ill, but instead based on occupation.
I kind of understand why you would want the people that are forced to work to get vaccinated before people that are not forced to work. That makes sense. It's just. It's very difficult when you hear that you want essential workers to get vaccinated and they could still spread it, because that seems to me to be that needs to be really expressed very clearly.
It's not being expressed clearly much at all. It is, because again, let's say you have that example. I mean, people over 65, my parents included, like. You're pretty much stuck at home.
Yeah.
Because of the very real danger that if you go out and you get infected, you could die.
Yeah.
The danger of this fact about how the vaccines have not been scientifically established to prevent the transmission of the virus, that's not being directly told to every single person who gets it, is a real problem, because then they go home.
Yeah.
Or they go and visit their parents who they haven't seen for a long time, or their grandparents, and could be carrying the virus and transmitting it unknowingly because they think, like, I'm good now.
Right.
I'm safe. And so that has to be part of this. I mean, to me, there's a direct scientific correlation based on facts that if you look at the people who are dying and who are being hospitalized, predominantly they are people over 65 years old. If we want to reduce those numbers, those are the people who should be prioritized to get this limited number of vaccines that we have first, then followed by younger, healthy people. I mean, and by doing that, really, we could reduce the numbers of COVID-related deaths by about 80%. Reduce the numbers of COVID-related hospitalizations by, I think it's like 48, 49%. That would have a massive, massive effect on people's lives and on our country.
Yeah, well said. And weird that that's not being said more often.
Yeah. I've been pushing both our state leadership in Hawaii and also the Trump administration. So the Trump administration, just in the last few days, I think it was January 12th, I think, the Department of Health and Human Services did actually adjust their recommendations. And they said vaccines need to urgently go towards people over 65. It is something that they have strongly recommended to the states. At this point, it's up to the states to choose whether to implement it or not. Texas is one of those states that has, and there are a few others. But at this point, kind of the lives of our parents and grandparents are in the hands of the decisions being made by the governors and state health officials in each state.
Catch new episodes of the Joe Rogan Experience for free only.
But it's a PCR to confirm infection. They ask patients to self-report symptoms, so the vaccine works. Just not sure if it prevents infection or just prevents symptoms. I don't know why Fossabot says I'm offline. The woman who chartered a plane for the insurrection and begged for money admits she doesn't need the money. Okay, but vaccines need to go over those 65. I'm young and healthy. I can survive COVID. Most people my age could. The elderly, however, are less likely. I don't think anyone is making the argument that, like, elderly people shouldn't get the vaccine. I don't know why they were saying that. I think everyone is in agreement that the elderly should get the vaccine. It was just one fucking dude who said that, old white people have... Amazingly, she leaves out the fact that we're forcing these people to work and exposing them to COVID, but then are saying that giving essential workers a vaccine is bad because of occupation or whatever. In Ontario, the elderly aren't prioritized for it. You'll survive, but your organs will get fucked even if you're young. This whole time, I thought you were anti-vaccination. Wait, what? Why? Why the fuck would I be anti-vax, dude? Wait, why do you guys think I'm anti-vaxxer? What the fuck? Is it because I've been playing as Hank Pecker? Is that why? Because I've been role-playing as, like, Hank Pecker or something?